It's Halloween, and instead of a scary story, I started my morning out by going to the dermatologist and doing a full body skin check with him. And I brought my husband with me. So we both are committed to having the skin checks done every single year, or more or less if the doctor tells us anything different. But we're planning on having that every year. So why would we want to get an annual skin check? Mainly because skin cancer, there's different types of skin cancers, but we're always concerned about melanoma. All of them, though, can be concerning, but they can start by looking like nothing at all. And even some melanomas might be clear or super tiny or start as a very small mole. And it's always good to have these things checked out earlier rather than later if it is something like melanoma or other skin cancers, because again, like I've always said in my videos, a more favorable outcome is when cancers are caught early and treated early. Dermatologists can spot these changes long before you or I ever can really see them or see if this is an actual problem. So when you go to the dermatologist for this, I don't want you to worry like this sounds invasive. And when you say head to toe, are they looking at private parts? The dermatologist will start in the scalp and look at your face and your neck, and you're in a hospital gown or a clinic gown, and you do leave on your underwear. And I'm saying all of this because some people will avoid going to a checkup like this for fear of embarrassment, and I completely understand that. You can choose to go to a female and not a male, or vice versa. You always have that choice with any providers that you see. And also, just because you might be assigned to a male doctor as your family medicine doctor or internal medicine doctor, or any doctor assigned to you might be male, you can ask for a female. That doesn't get in the way of your care, and it doesn't change if the insurance will cover it or not. Okay, so they're looking with different, not just with the naked eye, but with different types of things to get a good look at what each of those little bumps that look suspicious really look like to them, with an instrument called and they can see changes, like I said, before you and I can even see them. I've done videos on different types of skin cancer, and I did one on what it looks like on your nails. So don't forget your nails. The dermatologist is going to look at your nails and your toenails, your feet thoroughly. And again, they're not going to look at private parts. That is not included in this unless you have something that you are concerned about. Now, your dermatologist might ask you a question or say, can I look, just take a peek and look at something just to be thorough, but don't avoid getting this done out of embarrassment or shame. I also did a video on melanoma of the thumbnail, like I mentioned, or fingernails or toenails, and I also talked about cancer in the eye. I brought up different types of things, but that's why it's important to go to the dermatologist every year, go to the dentist. They're looking not just at your teeth, but your tongue, your gums, and your throat, perhaps, just like the eye doctor is looking at your eye and looking at the back of your eye to check for any type of cancer there. Getting a skin check is painless. It is quick, maybe 10 minutes. It is covered by most, if not all, insurance companies, including Medicare. And if it is not covered or you don't have insurance, the cost currently that I could find was $130 or $150 to $350 for a full body skin exam. Catching cancer early saves lives. Early detection and early treatment, no doubt about it, gives a better outcome and a fighting chance for people. So I started my day out doing that in the morning. And then I also went and had a little fun here on Halloween, and I got a pedicure, and I had lunch. I had lunch with a really good friend. So I hope you have a wonderful Halloween. Tomorrow is November 1st. So come on, it's the kickoff for the holidays, my favorite time of year. And winter coming up is my favorite season of all. If you are interested in videos about health topics, oopsies about healthcare, different medical stories, myths and facts about healthcare, please consider subscribing. My name is Lisa. I'm a registered nurse, and I hope to see you at the next video.